6-week pregnant symptoms and signs. This is an exciting time, as the most incredible things are happening inside your stomach. However, you may not feel like celebrating much due to early pregnancy symptoms and hormonal changes in your body. When you talk about pregnancy development, first question always tickle your mid, probably that how big is my baby at this moment? Well, your baby is now 4 to 7 millimeters long and the size of a pea. At 6 weeks, you'll probably look just the same from the outside, but inside, it's another story. Your baby is growing and changing at very fast pace and developing new features. This week's most important milestone, the neural tube begins to close over what will become your baby's spinal cord. The brain and nervous system are also developing quickly. There's more. This week, the areas that will become the eyes and ears have started to project as bumps, and other tiny buds are forming that will eventually grow into arms and legs. Heartbeat of about 105 beats per minute may be detectable in an ultrasound this week by a vaginal ultrasound scan, but you're unlikely to be offered one. Your little one will develop his or her face this week and will double in size by next week. That's fascinating. Weeks 1 to 8 are known as the embryonic period. Your baby is now an embryo. You might be feeling a touch hormonal by week 6, and now is the time to really watch your diet. Not only to give you nutritious, energy-giving foods, but also to make sure you are avoiding anything that could be harmful to your baby. Signs and symptoms at 6 weeks pregnant. You are probably feeling the same symptoms as you did last week, only more so. More nausea, more sensitivity to smells, and lower on energy. Be patient and don't try to fight Mother Nature. Here are some common symptoms you can expect during 6th week of your pregnancy. Frequent urination. Another symptom that you may not be expecting so early in your pregnancy. Needs to pee more often, but actually it's a common early sign. Shortly after you become pregnant, hormonal changes cause blood to flow more quickly through your kidneys, filling your bladder more often. Even in the first trimester, your uterus puts pressure on your bladder, giving it less room to store urine. Luckily, this pressure eases as your pregnancy progresses. Morning sickness. If you haven't yet had morning sickness, this may be the week it arrives. Morning sickness can happen any time of day or night. It may be triggered by certain movements, smells, an empty stomach, or nothing at all. Crackers and other simple, starchy foods can help, so keep a little something on hand for those random bouts of nausea. Gas and bloating. The pregnancy hormone progesterone can cause these tummy troubles. Drink lots of water and eat fiber-rich foods to avoid constipation, which contributes to bloating. Heartburn. During the first trimester, nearly 25% of women experience heartburn. The number increases the further along the pregnancy progresses. Heartburn usually feels like a burning sensation in your esophagus. It's so common during pregnancy for 2 reasons. Food moves more slowly through your digestive tract and your stomach is compressed due to an enlarging uterus. The best way to prevent heartburn is to eat small, frequent meals and avoid foods rich in acid. Tiredness. Pregnancy tiredness is the result of your body working overtime to produce all the necessary hormones to support your growing baby and placenta until the placenta takes over hormone production and baby support, which happens at the end of the trimester. Coupled with the fact that so many things are changing, including your metabolism and blood pressure, it's no wonder you feel wiped out during the first few weeks. Hormonal drives. Hormones begin to increase. They include elevated levels of estrogen and progesterone, HCG, human chorionic gonadotropin, the hormone that indicates pregnancy, and HPL, human placental lactogen, the hormone that promotes baby's growth. As hormones increase during your 6th week of pregnancy, your body might react both physically and emotionally. Hormones can also cause extreme mood swings and irritation. Rest as much as you can this week, and remember that you won't feel like this forever. Aim to eat 2 or more portions of fish a week, including at least 1 but no more than 2 portions of oily fish such as mackerel or sardines. Include some dairy foods like milk, cheese and yogurt, which are a good source of calcium. Remember that there's lots of support available to you. Talk to your midwife or doctor about anything that's worrying you. Give your feedback related to this topic in comment section, we would be delighted to answer. Thanks for watching. Join us on Health Space.